award in this field. Today, we are honored to have invited our experts, Vice Director Liang Xiaobo from CDC. This is the severest disease and outbreak of flu since early 2018, and National Health and Family Planning Commission has been given close attention to this flu. And we have done a lot of campaigns in preparation for the fight against the flu. You can go to the website of NHFPC for the information. Just yesterday, we have published another document about how to prevent the 2018 flu outbreak. We are intent on guarantee our general public's safety and soundness. We will enhance our surveillance of the flu and make some countermeasures. We will also do our campaign on the health education in an effort to prevent the worsening of the disease. Today, we are honored to have invited Director Jiang Yahui from NHFPC and Teng Fujian from CDC to brief us on the latest news about our flu prevention. And we will also have some other efforts. Since this is the first such a press conference in 2018, we really would love to present you more details, but we cannot take too long of your time, so we will prepare some writings afterwards to give you more of those details, in particular about our plan for the new year. Now, how about Liang Xiaobo from NHFPC about our latest progress? Thank you. Good afternoon. Yesterday, you might have watched the television. During the show on the television, we have presented you some information. We have introduced Professor Long's achievements in research. He has gained the highest science and technology award at national level. That is really a pride. And he is the pioneer in the virus development and prevention cause, and he used to be the director of Chinese Engineering and Medical Science Association, and he has been a chief scientist in China in fighting against AIDS and some other virus-related diseases. Speaking of Professor Ho, he has the achievements in the four following areas. Firstly, he's the pioneer of the virus, in particular the molecular virus science. And he has been granted the doctor's degree. And his tutor used to comment him that he is the only student that has been such a marvelous scientist in the beginning. In the 1980s, Mr. Ho has led his team to have a measurement about virus, including the sequence study and type C diseases and other cancer-related diseases. For 60 years, he has been dedicated to the campaign to fight against virus. And he has published a book with about 1 million characters talking about the molecule-based virology. That is the basis of our Chinese development of related science and technology in this field. In the 1980s, Professor Ho has developed his own IPR related drugs in China. He has blazed a trail for gene engineering. Such a medication development have been playing key important roles in fighting against some diseases. For example, the hepatitis B and hepatitis C. 10 years later, he has developed another 6 national-level new drugs. That's great achievements. And also, he has boosted the medical science and the biological science development in China. He has made a blueprint for the medical science development and biological science development in China by saving tens of thousands of lives. For example, his interferon developed has saved many lives in China, mainly the children with respiratory diseases. And besides, his other achievement is he has built a modern disease prevention system. For example, for the sudden outbreak of the infectious diseases, he has laid out his own philosophy of integrated prevention. At national level, we have seen some rounds of campaigns to fight against the viruses, and he has been a key player in those campaigns. Within a short period of time, he helped our national strength to observe such an outbreak of disease at an early date. For example, for flu, later Director Feng Zijian will give us more details. Our flu disease prevention center has made some similar efforts in the past. Our scientists have done many researches and surveillance, and also subject to the surveillance by the national government after the years. We have also prepared our national level prevention and control measures. All in all, Mr. Ho has been a very successful scientist, and he's a Marxist, of course. For the first time, he has submitted his application at the age of 24. In 1981, at the age of 52, Professor Ho joined the Communist Party. So Professor Ho has always taken having a better idea of the world and saving more people as one of his key guidelines. And he has published many documents and has developed many drugs and medications, in particular those antivirus drugs, interferons, and saving the whole nation at an urgent time. During the 19th National Congress, we proposed the idea of building an innovative country that is a new philosophy. And for us working in the health sector and the disease prevention sector, we need to meet the higher requirement. So at this time, we particularly need to champion the spirits of people like Mr. Ho, so that we can achieve our goals of great rejuvenation of the Chinese nation and the 2 centenarial goals. That is of great significance. So I would like to take this opportunity to pay my gratitude and appreciation to Professor Ho again. Another information, since as I said, Mr. Ho has gained the highest level national award in science and technology. But in addition to Mr. Ho, Feng Zijian, director, and our other CDC experts have also made some achievements. They have gained some awards. For example, the National Technological Advance Award. And some other experts sitting here have won the first level Science and Technology Award in 2014. So all of the experts sitting here have been renowned scientists. For their perseverance and support, we feel deeply honored. And we must keep working along with those experts to fight against the diseases. Now let's allow and give the floor to the National Health and Family Planning Commission expert to give us more information about their plan this year. Ladies and gentlemen, good afternoon. The theme of the press conference is about academician Hou Yunde's information and the 2018 plan for the health sector. I would also love to give my congratulations to Mr. Hou for his winning the award, and for those who has been supportive of the health industry, for example, the media friends, all of the entities and different social sectors. I want to thank you. Now, a brief introduction about the flu prevention in 2018. The epidemic of flu has been a respiratory disease. It is highly frequent in winter and spring. Some of those might have the other indications, and the flu might be very severe. Since 2017, the flu epidemic has been rising in cases. In many outpatients and doctors, we have seen the rising number of the patients hospitalized, and the experts believe that since this winter, the peak of this flu has been because of many reasons. For example, winter is usually the peak season, and this year, the dominant strain has been very unique. That leads to the higher number of patients, and we believe that such a peak will last for another period of time. With the winter vacation around the corner, I think this situation might be alleviated, and the State Council has been paying close attention, and according to the requirement of the State Council, NHFPC have published the document on the flu prevention efforts in 2018. We will focus on the following efforts to guarantee our general public security and safety. Firstly, we will enhance our surveillance of the flu. We will give full play to the hospitals and network labs to do the surveillance work. We will have the ground surveillance and the reporting system to follow up the situation development of the flu in order to take some related measures. We will also work with the educational sector, for example, the kindergarten, primary schools. We will have some checkups of those students, for example, who is not at school this day, and we will also have our own treatment plan sent out to those entities. We will also train our doctors and other medical practitioners. For the elderly people, children, pregnant women, and those people with diseases like mild diseases, we should warn them of taking cautious measures to take those drugs. For the hospitals, and we will send some provincial level experts to the grassroots level hospitals to help them do this work. And for the antivirus drugs, we will have very strict surveillance of those purchasing of those antivirus drugs, so that we can guarantee the supply of those antivirus drugs. We will have an alliance of all of those medical institutions and allow some big hospitals to play a leading role. We will have some on-site training and guidance and allow those big hospitals to play a leading role. We will have some distant educational courses so that in the alliance we will have more training of the lower level hospitals. For the grassroots medical practitioners, we will enhance their training so that they can have an early detection of the flu and have higher capacity in dealing with them. Fourthly, we will also give play to the grassroots level. The medical institutions in grassroots level must have a close monitoring of their own jurisdiction and enhance their education promotion. For the subjects, they need to have some promotion campaigns to send out the information. And the practitioners, while doing their regular work in treating those flu-infected diseases, for the severely infected diseases, they must submit the information to the higher level hospitals for more help. And fifthly, we must have more educational campaigns through broadcasting, television, and other media channels and websites like WeChat or Sinoblogs. We must publicize the knowledge about the flu and some related measures. We organize the experts to target at the general public and the key prioritized groups for separated and distinguished information transmission. And also, according to the needs, we must send out the science and knowledge so that our experts could interpret it and respond to the concerns of the public. For the practitioners, our training needs to continue to improve their capacity of treatment.
And for the severe patient, we will organize the national experts to conduct consultants to ensure their safety and health. Thank you. Now the floor is open to questions. Please, one question only for each person, to each journalist. Hello, I heard that Mr. Ho is a founder for the modern theory of infectious disease. Can you brief us on that situation? Can you tell us more about the treatment and prevention mechanism for infectious disease system? Currently, this system is focusing more on prevention of infectious disease, or ID, that is the discovery of this disease. For example, the flu, we need to go through the test first, and then we have multiple testing stations and internet labs. Once a strain is discovered, we will carry out the testing, and then large trials of tests and drugs will be implemented, and then in some virus-related disease, for example, the H1N1, bird flu, this vaccine was produced after only 80 days of the outbreak.
一下您的问题。那么今年的这个流感啊，从临床的症状上来讲呢，跟以往的这个流感没有什么特别的特异性的这个表现，都是高热呀、畏寒呀、全身肌肉酸疼啊、乏力呀，这些流感的典型的一些这个表现。那么今年有一个跟往年不同的特点呢，就是今年除了
This year, there's one syndrome that is different from previous years. We see more infection of type B, of type A, but less patients on type B. For type A flu, there are less patients but more severe conditions and syndrome. And also a small number of the patients is a mixture of type A and type B. And there is also some acute outbreak in some patients. People pay a lot of attention to the outbreak of flu. Our pediatrics and emergency room are also facing a lot of pressure. However, faced with this severe condition, the medical system nationwide and the staff are pulling all the possible efforts and methods to fight against the flu. The NHFPC, starting from last year's November, we have a contingency plan for the peak flu season. There are very clear requirements, and also teleconferences were held in order to better mobilize the pediatric resources in order to meet the demand. In some children's hospitals, so the flu center carry out surveillance on the mutation and of the flu virus. Currently speaking, this virus shows no signs of mutation or drug resistance, and the traditional medicines such as Tamiflu are still effective against this disease. And third, we also carry out educational activities on the prevention treatment of flu. You can check out the latest information through multiple channels, pamphlets in hospitals, and also news terminals and portals. There are a lot of information on the prevention treatment, especially for children and elderly people. Through this kind of health education campaign, we would expect that the general public can have a better knowledge of the flu, and if you have the disease, you can have a better idea of which hospital you should go to or which medications you should take. Sometimes people tend to go to big hospitals even if they only have the flu. However, it is sometimes not that necessary, and because too many people, if crowded in hospitals, will become a large source of infection. And not long ago, we issued a notice on the treatment and prevention of flu 2017 to 2018, strengthening the method and make it more specific. And we'll also hold teleconferences on flu prevention and treatment. Thank you. Next question, please. Just now, our colleague has briefed you on the situation, and you also talk about vaccine. Flu is a respiratory infections, and it's really difficult to prevent. And you need to wash your hands frequently and wear masks if necessary. These are preventive measures against respiratory infection, and these are non-medical, non-medication treatment. But none of them are as infectious as vaccine. So flu vaccines, unlike measles vaccine or polio vaccine, they are very effective, and is currently the best method proven to guard against respiratory infection, and is far more effective than non-medical measures. But if you are pregnant, you need to ask your doctors whether you are suitable to take the vaccine. Each year, according to statistics, about 26 million vaccines were used in a market. Which is far less than those the number of the high-risk population. So it is strongly suggested that if you belong to one of the high-risk groups, to receive vaccines. One more point, the level 4 vaccine which is recommended by WHO and was beginning to be used starting from the year 2016. And the producers of the vaccine is about to be put into the market. There are also some other producers are filing for clinic trials and clinic research on the testing of the tetravalent vaccine of flu, or the QIV. I'm with CCTV. My question goes to drug supply. Earlier this year, we found that to take the Alstavi within 24 hours of infection will be effective. But Alstavi is very difficult. It's not very easy to get prescription of also Tamvi in hospitals, because there is a severe undersupply of also Tamvi. And I also heard that in some hospitals, all the pediatricians fell ill because the working pressure is too big. So how do we guarantee the health conditions of the pediatricians?
Thank you for your question. I heard two questions. The first one is about this guarantee of those drugs, and the second question is about the pediatrics department. Actually, there is another related question about how to care for those practitioners and the children. First, I want to answer your first question. I think we would encourage our media friends to send out a piece of news that is our guarantee of those and supply of those drugs is not a problem. We have sufficient supply of those drugs, and by now, for the usual flu, we have the Tamiflu, and we also have another drug, a spray. And in recent years, we have successfully developed a drug to help those severely infected disease. This drug is called a Paramivir. So we have full confidence that in terms of the drugs against the flu and other virus-related diseases, we are fully capable. And as to the treatment plan of flu, over the past years, we have introduced such plans to fight against the flu, and we encourage the early adoption of those drugs. For example, the oseltamivir must be taken in the first hours. That will generate very good effects. Now, as to the supply of the drugs, in some hospitals during the peak season of the flu, if you pay visit to the hospitals, you might encounter some short supply of those drugs. For those cases, we have already been aware of them, and yesterday we have introduced our new document. We have already started paying close attention to these cases. We will have our own requirements for the hospitals across the whole nation. For example, they must have some purchasing power to procure those drugs against the acute flu, including drugs like Telamivir or oseltamivir. And for the health and family planning commissions at different levels, we must guarantee a green route and pathway for them to have instant purchasing of those drugs. We do not allow any excuse to hamper the supply of drugs to our patients. And besides, we will have some follow-up measures to monitor the situation. If we have discovered some supply issue, we will immediately have some follow-up steps to solve them. That is the answer to your first question. The second one about the pediatrics department. Since 2016, several departments have co-published a document on how to enhance the medical service of the pediatrics department. It is fair to say that the things related to the pediatrics has gained close attention from the State Council and national government. At different localities, they have all been making attempts to step up the improvement of the pediatrics department with different measures. For example, building more children's hospitals. And in the children's hospitals, we will set up more pediatrics departments. And as to the doctors, where do they come from? We have enhanced our cooperation with the colleges to cultivate more good graduates from the Department of Pediatrics. We have stepped up our training of those newly graduates, and we have also enhanced training for the unpost doctors if they want to transit their posts. For example, if some doctors are willing to take a different job, we are more than happy to offer the training for them. With such training, we can actually open up more opportunities for those doctors. For the doctors and other practitioners, we must increase the supply of those professionals. As to the supply of drugs, we have also taken some measures, in particular targeting at the supply side of the pediatrics department. in order to improve the resources in the pediatrics department. But of course, in some hospitals, the pediatrics department is in a small scale. In some, it's very small. So the number of practitioners in the pediatrics is very small. Under such an intense working condition, our doctors are rather tired because they're not God after all. Days ago, I've seen a news in Guangdong. A doctor from pediatrics department could not even speak after work. He has given some notes to the parents of those children in order to inform them of the treatment plan because he could not speak. And for the outpatients and the emergency rooms doctors, we all are working around the clock in order to respond to the needs of those children in the peak flu season. We have some medical alliances between different hospitals and institutions. By working together, we are introducing the different measures so that we can do our utmost to meet the needs of our patients. We also hope that such cross-hospital cooperation could be carried on, and more practitioners could join this force and implement all of those measures in their post. The third question. It is true that this has been a key focus of our commission. Last week, we have finished the conference on improving health conditions in China. Director Li Bing and Wang Kesheng have joined the conference, and this morning we also have a shuffling conference in the People's Hall. During those conferences, we have been mobilizing the different forces to pay more close attention to care for our practitioners. For example, improving their salary or the price of the medical services. With those measures, I believe we can mobilize the enthusiasm of those medical practitioners and increase their value. And we also hope that the different administrative levels, even in the hospitals, could care more for those doctors, whether concerning their work or their families, so that deep rooted in our minds, we know the importance of those doctors. And on about August 19th, 2017, we have decided that we should have a date to celebrate the doctor's work. So we have decided on the Day of Nurses, set on May the 12th, and another one is for doctors on August the 19th. We will conduct several activities to celebrate these 2 days, and we are actually conveying a very good piece of information to the whole society, that is to care for all of those medical practitioners and respect their work. Only that way can our practitioners be more patient and more willing to offer good services to the patients. Thank you. I come from China Science newspaper. Just now, Director Liang has introduced to us about our academician's past history, saying that under his leadership in 2009, China has successfully prevented the global type A flu, gaining 8 firsts in the world. So I would love to know about the 9 firsts. I will be the first one to give you more information. You know that type A flu in 2009 is a very severe disease back then. Many ministers and national level leaders have convened many conferences to think about a solution to the disease with very good effects. And Academician Ho has been one of the key members leading his members and groups. As to the details, we will ask the expert to give us. As we know, yesterday, Mr. Ho was granted the State Science and Technology Top-Level Award. That was really something to celebrate about. For those who has always been concerned about the work done by Mr. Ho and his team, I would be happy to give you more information. As the journalist has mentioned, as to the first, I would give you some information. Firstly, he has set up a mechanism of coordination. Such a philosophy has become a very important mechanism to play its role in days of flu. And secondly, in the international stage, we are the first one to successfully develop H1N1 flu agents. And thirdly, we are the first one to prove that in the peak season of flu, one person might actually contagion another 1.3 or 1.6 person. That is the discovery he has made. And fourthly, for the first time in the world, he has revealed the new features and syndromes of the new type of type A flu, so that we can rank among the top level in terms of the solutions. And fifthly, as to the traditional Chinese medicine, he has made some breakthrough to treat the flu. The traditional Chinese medical doctors could be able to treat flu, and he has gained the international recognition. And sixthly, he has developed the vaccines to the new type of flu. That is record-breaking news. And the patients only need to take one shot of such vaccine to be treated with the disease. According to the WHO, back then, the patients usually need to receive 2 shots in order to be cured. And seventhly, he built the largest scale surveillance system. And this has been highly recognized by international organizations. Eighthly, he proved that the hemagglutinin and the ammonia has been related, and that is a good social effect. He set up a precautionary mechanism, and public health academy and other institutions have all taken the measures to reduce the morbidity and mortality rates of flu, reducing about 17,000 patients hospitalized. That is a very good achievement. Those research results have been spoken highly of by WHO and other international organizations. And in 2014, he has been granted the National Science and Technology Advance Award. Thank you for your introduction.
And with Xinhua News Agency, most of the flu patients will come to big hospitals, and it's probably because at some grassroots hospitals they do not receive fever patients. You also mentioned that it is not advisable for flu patients to be crowded in big hospitals, but they cannot receive medical treatment at grassroots level medical institutions. How do we address this kind of conundrum? I'll take this question first, and my fellow speaker will make some supplements. At grass level, according to the medical reform, they are the priorities, and their capability needs to be further strengthened. They need to carry out major responsibility to treat the commonly seen diseases such as fever and flu. So back in 2004 and 2005, when Ms. Wu Yi was head of a minister of health, we issued a notice according to which when infectious disease patients were discovered, they have to be admitted to big hospitals as fast as they can, especially when it comes to respiratory infections, because their methods of infections is more convenient than that of blood infectious disease. So all of the medical institutions have to have this kind of system. That is to say, level 2 and level 3 hospitals have to carry out this kind of system to guard against the seasonal infectious disease such as intestinal diseases as well as respiratory infectious disease. Through the system, it is our aim to divide general fever from infectious fever patients with fever. So at grassroots, we also need to have this divergence of diagnosis. If a patient is diagnosed with fever, he does not necessarily has to be an infectious patient. It might be just a normal normal fever caused by other diseases, and it can, without a doubt, be treated at grassroots level instead of having to go to major hospitals. But if there is suspicious cases concerning respiratory infections such as the SARS cases and H5N1 bird flu, these are specific strains and diseases. If this kind of cases were discovered at grassroots level, they have to be transferred to major hospitals as soon as we can, even if it's only on suspicion of such a case. This is a question of public concern, and So that's why today we have the top leaders from NHFPC and CDC. Now, thank you. Thank you for your concern at the grassroots level. And grassroots level medical service is a foundation. I think 90% of emergency cases were resolved at grassroots level. It is very close to the public. It's deeply rooted at the general public. And during the prevention treatment of flu, the grassroots medical institutions can play an important role of carry out preventive measures, because it has very targeted group of people and small communities. Therefore, it's a very good place to carry out health education on prevention of flu, and because the flu can be largely prevented if you have better information knowledge of this virus and disease. The medical institutions should guide the patients, if necessary, to receive treatment. And also, the vaccine is largely given at grassroots level. So we need to strengthen the capacity as well as training of personnel at grassroots level, and also standardize the treatment of flu, strengthen the treatment of staff so that the grassroots medical professionals can have a better capability of diagnosis and treatment. And if it cannot be properly treated at grassroots level, it should be transferred to major hospitals in a timely fashion. But there is still a gap between regions and urban and rural areas when it comes to service standard and quality. That's why we pointed out that we need to further strengthen the capacity at grassroots level medical institutions, as well as the training of general practitioners. That is very important to the strengthening of medical system at the fundamental level. Thank you. Next question, please. And with China's newspapers and population, this year the morbidity of flu is higher than that of previous years. Why is that? And some people claim that even vaccines do not work. What is your take on that issue? A rising morbidity of flu is observed this year. The reason is mainly due to the slight mutation of the virus. It's not a big mutation, but it is one of the major causes for the flu pandemic, causing it gives rise to the fact that people's immunity seems to be weaker when faced against this kind of flu virus. And this year's flu pandemic is caused by the type B Yamagata virus, which has not been prevalent for several years, and there is very small number of infectious cases. Therefore, the immunity against such a Yamagata type B virus is very weak. That's why when it becomes prevalent this year, the morbidity also surges. It can be foreseen that with the prevalence of the Yamagata B virus, in the next peak flu season, it will not become the mainstream of virus that caused a flu. These are all very common phenomenon when it comes to infectious disease theory. Or there are different strains of virus each year, and also slight mutations going on, and thus causing this kind of periodical outbreaks year by year. So each year, the characteristics of the flu virus and flu strain might be different. It's very common. The recommended time of receiving vaccine is around August to October, because, as I said, there is this kind of periodical and seasonal outbreaks of flu. And winter, late autumn to winter would be the peak flu season each year. Therefore, you need to receive vaccination before the peak flu season, and that will be more effective. And there's one more factor. If you do not receive vaccination before the flu season, you can still receive vaccination during the season, and you'll be protected from now on to the end of the flu season. But it's best if you can receive vaccination before the peak season. And with China's family newspaper, currently there is a high-risk group, including the children, the elderly people, as well as non-communicable diseases patients, and how to strengthen preventive measures for these groups of people. So first is of course vaccines. If you have high-risk group of people living at your home, or people living with non-communicable diseases, they are the high-risk group, and they are strongly advised to receive vaccination. So if your family member includes children or elderly citizen, it is advisable for them to receive vaccination, especially for the kids. Kids are usually the ones that bring the virus into the family, but at the same time, the elderly people would have a very weak, comparatively weak immunity against such a virus. And also the non-medical treatment, non-medical preventive measures would include to reduce contact, maintain a reasonable proximity against the strangers, and also wash your hands frequently and wear masks if necessary when it comes to public spaces. If your family, a member is infected, and one of the other family members would be a high-risk group, you need to limit as much as you can the contact between the infected member and the high-risk member in order to reduce the possibility of infection. So vaccine comes first. Now, as Dr. Li Xinwang from Ditan Hospital. I think vaccine, as Mr. Feng said, is very important. And another is preventive drugs. it is advisable for a high-risk group to receive some preventive medication, especially when other members of the family are already infected. And close contact cannot be avoided, so it's advisable to intake antivirus drugs. If you some senior citizens are in their 80s or 90s. They do not have a severe infection, but they have to be hospitalized because their condition is just very specific and very precarious.
Another point is, if we go to the hospitals, we will know that for the highly vulnerable people and the ordinary people, usually they swarm together to the hospitals, and about half of them are actually suffering from flu. The general public usually will take flu as the usual coldness. There are two issues with that. The first thing is they don't take it seriously. They think it's just a coldness. And the second type of those patients is taking it too seriously. Now we are talking a lot about the education of the general public, so I think for this, we need to be cautious. There is a clear difference between coldness and flu. Flu usually have no cause. He just has a sudden fever, and he feels sour in every part of his body. That is flu. In that case, in particular, for the vulnerable population, they need to go directly to the hospitals for treatment immediately. They must receive the antibodies or other vaccines, and after 2 days, that's too late for them to receive treatment. For the usual coldness, if their fever is about 37 or 38 degrees, or they are having a lot of tears or snots, or they sneeze a lot, for this type of people, they have no high fever and no sour feeling in their body. They can just help themselves by drinking some water. If they feel like it's flu, then they need to go to the hospitals. Otherwise, they can just stay at home and do some usual preventative measures. So there is a distinguishment that we need to be clear about. We need to protect not only ourselves, but also our family members. If you have a flu and you go to the hospitals, you need to protect all the other patients in the hospitals to avoid infecting the others. Thank you. I would also like to thank all of the guests and all of the journalists. Even though it's very cold today, you are coming here with enthusiasm. All of the questions raised are very professional, like surveillance, the treatment, clinical services, and grassroots level hospitals and vaccines. All of those questions are of great importance to all of us. And I want to thank you for your concerns about the general public. And this could signal that you care not only for the public, but also the practitioners. I hope that you could help us to transmit the objective piece of information about the situation. For the public health workers and the government workers, we will all work together and join force to improve the situation. And I hope that also the media friends, you need to pay attention for your own health and care for yourself. This is the end of the press conference. Thank you.